The UW system's plan to get COVID cases under control is working well for them, but it may not be practical elsewhere. Amanda Quintana shows us what's being suggested and the challenges other colleges would face.
When Dr. Deborah Birx was here last week, she commended UW system for what they've been doing to get their case numbers down, testing students weekly to find people who are asymptomatic.
They're constantly finding those cases early and isolating them for 10 days.
Dr. Birx suggested communities do this too, testing 18 to 30-year-olds proactively. But state health leaders say there just aren't enough tests to do that.
There is not the testing infrastructure in the United States to do that.
There also isn't really a system to test technical college students either.
It's a great idea. We support the concept. We support containing the virus, obviously. It's just challenging given the unique nature of our structure.
Connor Smith with the Wisconsin Technical College System says a lack of dorms and testing abilities on those schools across the state would make it hard to quarantine positive students.
To me, it isn't a question of how do we find asymptomatic students. To me, it's a question of how do we prevent asymptomatic students from infecting others.
Smith says masks, social distancing, and temperature checks on campus are working. UW's plan does still offer a roadmap that all communities can use.
We don't need to test the whole population in order for that strategy that was effective on the campus to be effective statewide. What we really need to do is be serious about every single case that gets isolated effectively. All exposed people get tested and quarantined.
Another big piece of UW's success is that almost all students and staff have been wearing masks in public. Amanda Quintana, News 3 Now.
The DHS says it's working hard to improve access to testing. If you think you've been exposed, there are more than 70 community testing sites around the state.